I'm very pleased to talk about the patient bill. This bill reauthorizes PCORI, the Patient-Centered Outcomes Research Institute. PCORI does truly foundational work. We're looking at how to improve the healthcare system. This is the research we want to support. How do we provide care and how do we improve that care? How do we make the patient experience better and more effective? How do we help physicians and clinicians make more effective decisions? That's the role of PCORI. Its mission is to fund research that will provide patients, their caregivers, and clinicians with evidence-based information needed to make better informed healthcare decisions. And what's so great about PCORI is that there must be a demand for the research. PCORI doesn't just give away dollars to any project with potential. Projects must demonstrate there's a legitimate reason for the project and a patient community that can benefit from the information. The questions their research seeks to answer truly are patient-centered, driven by the needs of patients, clinicians. They look at the outcomes important to them and they generate results meant to inform their decisions. Earlier this week, I met with Dr. Rob Himes, who's chairman of orthopedics at Fairfax Inova Hospital, to look at their three big examples of PCORI research. One was the REGAIN trial developed by the University of Pennsylvania. This is a multi-center randomized trial comparing the outcomes of individuals 50 years or older, 1,600 different individuals across the country, receiving either regional or general anesthesia during hip fracture surgery. Hip fractures occur more than 300,000 times each year in America, and the estimated costs attributable to hip fractures in the U.S. exceeded $12 billion in 2005, has the potential to exceed $18 billion by 2025. So the REGAIN trial aims to assess throughout the 1 year after surgery the effects of spinal versus general anesthesia on recovery, including overall health and disability, pain, cognition, postoperative delirium. This is the largest ever randomized trial comparing spinal versus general anesthesia after surgery. I've seen the negative side effects. Both my father and father-in-law had new knees, 3 of them between them, and you saw really significant impacts on their cognitive behavior after having received the general anesthesia. Their knees got well a whole lot faster than their brain did. Results from this study can really help patients and caregivers better plan for their care. Since PCORI's founding, there have been 750 different studies, important life-saving patient studies. 325 have already led to published results available at no cost to every hospital and physician in the world on the PCORI website. Patients and caregivers face complex and confusing choices, and PCORI's whole research is not fundamental research like on NIH, it's not drug research like FDA. It's there to fill gaps in evidence for the physicians actually serving patients each and every day. At the end of the day, we're all going to be patients at one time or another, and we all deserve the best care. I'm happy to lead the charge for this important, comparative, effective research to help improve patient outcomes.